And one of my jobs is to keep track of all the disinformation that's out there about health insurance reform.
Thanks, Linda. On Tuesday, August 4th at 6:54 a.m. in a post entitled "Facts Are Stubborn Things," the official White House blog warned that, quote, "scary chain emails and videos are starting to percolate on the internet, breathlessly claiming to uncover the truth about the president's health insurance reform positions," close quote. So the White House needs your help, America. In that very same blog post, they wrote, quote, "If you get an email or see something on the web about health insurance reform that seems fishy, send it to flag@whitehouse.gov," close quote. Some might think that seems a bit big brotherish, but not us and not now. The government takeover of healthcare is too important. We decided to take matters into our own hands and help the White House find these criminals. First target, Peter Suderman, associate editor at Reason magazine. Listen to Linda describe Peter.
There are people out there with a computer and a lot of free time.
Peter's so smug with his little hat and his CBO citations. We'll get to the bottom of this. Peter, are you responsible for spreading lies and misinformation about the Obama administration's healthcare plan?
I don't think so.
Nice try, Suderman. You're lying through your teeth, you tool.
I mean, I've repeated what the Congressional Budget Office has said.
Suderman, give me a break. It's people like you and the CBO who are taking Obama's quotes out of context, like when he said if he could start from scratch that...
I would probably go with a single-payer system.
Or that...
I happen to be a proponent of a single-payer universal health care plan.
The people who always try to scare people whenever you try to bring them health insurance reform are at it again.
That's right, Peter, you're at it again. It's not just that you have a principled intellectual disagreement about incompetent bureaucrats controlling 15% of the economy through state-run healthcare, or that you write regularly about the fact that more than 88 million people could potentially lose their private employer-based coverage. It's that you're using reliable sources, data from the CBO, and cold, hard facts to scare people when making your arguments. We'll see you on the flip side, Peter, and don't do this again.
Pacific Prime is the world's largest distributor of international private medical insurance to individuals, families and SMEs around the world. In 2013, we were awarded the Top Global Distributor Award for Bupa International and IHI Denmark. So what does this mean? Well, what we hope is that we'll have the opportunity to spend 5 minutes talking to you at the start of the process when you're looking for health insurance. And in that process, we can understand your needs and we can start to help you understand a health insurance plan and how that plan is put together. So let's take an example. If you're living and working in Europe, let's say Poland, then it's important to get a good health insurance plan. Not only to access the healthcare facilities in Poland, perhaps to also access the facilities in the country where you come from. That could be Australia, it could be America. But getting a medical insurance plan that's going to allow you to do that is part of the process that we would go through if that's important to you. So what is a healthcare plan? How is a healthcare plan put together today? Normally the plans are modular. So different modules that you could possibly buy are the inpatient components, the outpatient components, optical, dental, well-being, maternity insurance if that's important to you, evacuation and repatriation if that's important to you. And then beyond that, there are things like direct billing. So if you're living and working in Poland, are you able to access that hospital or that clinic that's important to you by just showing your card? Also, we would consider things like covering pre-existing medical conditions. Things such as chronic conditions. Do they covered or are they not covered? Is the plan guaranteed renewable? I can't go into everything, but as you can start to see as I lay this out, there are many, many different aspects of a health insurance plan that could be important to you. And our job is to help you understand the whole plan and what is right. Then based on your needs, we can select the modules that are going to be most important. We would then go away and review the insurers to find the right plan. So we would look at Bupa and Allianz, Cigna, Aetna, DKV, AXA PPP, all the brands that you've probably heard of. But we'd also review perhaps plans you've never heard of, so companies like Integra Global, Interglobal, IMG, a la carte. These are insurers you may never have heard of, but they may well be good solutions for you. We would then come back to you with a limited number of options from different insurers and different plans. And from that shortlist, we would help you review which plan is going to be most suitable. So, if you're living and working in Europe, let's say Poland, and you're looking for a good health insurance plan, why not spend 5 minutes talking to us? I'm very confident if you do, you're more likely to buy the right plan for you and your family.